Welcome to our webinar. We are here today to provide information on the K-12 prevention allocation. I'm Stacy Frohnapple-Hassan, and on behalf of the Ohio Department of Mental Health and Addiction Services, I'd like to welcome you to today's K-12 Prevention Education Allocation Informational Webinar. Before we jump in, I want to cover a few quick housekeeping items. Should you lose audio or visual connectivity at any point today, after checking your audio settings, we suggest leaving and rejoining the webinar as a first step to resolving the issue. Due to the size of today's audience, we will not be able to provide individual technical assistance. We encourage you to use the questions pane in your GoToWebinar control panel to submit your content-related questions and comments throughout today's session. We'll prioritize and group questions and address as many as possible during the Q&A period. We apologize in advance if we're unable to get to your question in the time allotted. A frequently asked questions document will be posted in funding opportunities within a couple days after the webinar. At points in today's session, you may be asked to raise your hand. Take a minute now to find the raise hand icon in your GoToWebinar control panel. Let's see how many fields are represented today. Raise your hand if you represent an Atom board. All right, thank you. Raise your hand if you represent a service provider agency. All right, and how many of you represent a related service organization, such as a school district or an educational service center? Excellent. We have hundreds of organizations represented today. Next, to download a copy of today's PowerPoint slides, you can click on the linked files under Handouts. You'll also find the letter of intent there and a couple other helpful documents. All of those will also be available in funding opportunities on the Ohio MHAS website after the webinar. One last thing. If you're joining us as a group today, please use the question box now to tell us the name of your organization and the number of people in your group. A quick overview of the structure of today's webinar. First, the overview will include the background and process from Ohio MHAS Deputy Director Bobby Boyer. Then we'll review the funding information and content-specific questions you've submitted using the questions box. And now, Deputy Director Bobby Boyer.
Greetings. As Stacy said, this is Bobby Boyer, Deputy Director over the Office of Prevention Services. It's great to be able to share this opportunity with you, and I look forward to our partnership together as we launch this initiative. So I'd like to start with providing a little background on this initiative and the investments that have been provided through our state government and the priorities. Under the leadership of Ohio Governor Mike DeWine and the Recovery Ohio Initiative, the Ohio Department of Mental Health and Addiction Services and the Ohio Department of Education will collaborate to distribute $18 million included in the state fiscal year 2020 budget to support prevention education for K-12 students. This state partnership will empower local communities in their efforts to help children build resiliency and reduce risk factors that contribute to the development of behavioral health conditions. This critical investment will assist communities with the ultimate goal of providing evidence-informed prevention services for every child in every grade and every school. In addition, the state fiscal year 2020 budget provides $1 million in each fiscal year for the Ohio Department of Education to invest in professional development grants to educational service centers. These grants are for training educators and related service personnel on the models and tenets of prevention of risky behaviors, such as substance abuse, suicide, bullying, and other harmful behaviors. This is a good time to offer a brief announcement from our partners at Ohio Department of Education. The request for proposals will be going out soon for the $1 million each year professional development grants to educational service centers. There will be 5 regional grants offered for this training. This is another opportunity for boards and providers to partner with educational service centers to develop a response for your region or to provide input on training resources available to them. Now let's practice that show of hands again. I'm wondering if I can ask you how many of you that our boards and providers have a regular working relationship with your educational service center? Go ahead and put those hands up. Are we seeing any over there, Stacy? All right, I see a large crowd. Awesome. That's amazing. Well, I'd like to also take a minute and just acknowledge some of our key partners that have worked on the fine details of this initiative. I tell you, we even had Superintendent Demaria doing some editing on our documents for this. So you know we've had a better product because of the amazing expertise we've been able to draw upon. Director Chris did most of the bridging between our departments and did a great job of fine-tuning all of us. Thank you all for your expertise and patience, and I especially thank Stephanie Siddons for being willing to answer my every call when we were asking for help and input to share our language between our different fields. Thank you all for your help. So, strong community partnerships enhance the delivery and collective impact of evidence-based prevention services. Together, schools, educational service centers, county alcohol, drug addiction and mental health boards, health departments, and other key community partners will prioritize this K-12 prevention funding to expand programs, practices, and services that meet the continued needs of all students in their districts. When communities support their schools with a focus on building resiliency and reducing risk factors, we can truly make a difference for our children and families. These programs and services are more effective when delivered within a best practices framework for school-based prevention. Examples of such frameworks are Ohio's voluntary K-12 social and emotional learning standards. Social emotional learning is the process through which children and adults acquire and effectively apply the knowledge, attitudes, and skills necessary to understand and manage emotions, set and achieve positive goals, feel and show empathy for others, establish and maintain positive relationships, and make responsible decisions. Research demonstrates that students who receive support for social and emotional learning in schools do better academically, socially, and behaviorally. Social emotional learning has also been shown to positively impact economic mobility and mental health outcomes. Developing these skills in our students is an important part of meeting the needs of the whole child. Trauma-informed school practices is another great example that can be implemented within the school's existing framework of positive behavioral interventions and supports, or PBIS. In a trauma-informed school, the adults in the school community are prepared to recognize and respond to those who have been impacted by traumatic stress. Positive behavioral interventions and supports is a way for schools to encourage good behavior. With PBIS, schools teach kids about behaviors just as they would teach about other subjects like reading or math. The focus of PBIS is prevention, not punishment. In years past, with the Safe and Drug-Free Schools and Communities Act, schools and communities learned how to work together to meet the needs of students using a specific framework. I know that some districts have continued to build on that work over all these years, despite the loss of those U.S. Department of Education dollars. Some of the components of that program have blossomed into best practices that are recognizable in different forms today, such as the PBIS or positive behavioral intervention and supports social emotional learning. I'm wondering how many of you on the call worked or had involvement with programs and services through the Safe and Drug-Free Schools Communities Act. Let's show those hands again. Okay. So do we have any hands with that one? I think we have some. All right. Okay, good. Glad to hear it. That means you've been around for a while. We've got some experience in the crowd. All right, this next slide, I want to go into some detail. There's just a couple of slides that I really go into some detail, but this is really the framework that we're talking about for this initiative. Here we've listed the components of a best practice framework for the prevention continuum in schools. In order for prevention services to have the greatest impact, they will occur within the context of these prevention practices. The following elements should be included in a best practice framework for prevention education and services within the school environment. The first is school community partnerships. We know that most communities have strong partnerships already. We hope you will use this opportunity to build on those existing relationships and open the door to others that can bring assistance to this planning table you will prepare. Needs assessment process. The needs assessment occurs on a number of fronts, including examining data that is available through student surveys, community health assessments, along with student data related to discipline, for example. This initiative will include a self-assessment tool to assist with identifying the needs of the school district. Policy change and development. Policies like annual professional development for staff around identifying signs and symptoms of alcohol and drug abuse support good prevention practices. Full continuum of prevention programs and services targeting specific risk and protective factors. Prevention services need to be available across a full continuum. As the needs assessment process identifies specific risk factors in the school and community, programs and services can be targeted to those factors and students that may be at risk for those behaviors. Building positive relationships between healthy adults and children is one of the most important protective factors schools can build. That is why increasing the number of adult volunteers that are interacting with students is so important. When programming decisions are being made, the adult-student ratio can change the success of a program immensely. The next one is social emotional learning integrated within all academic instruction for K-12 students. Ohio's SEL standards will be a great asset to move this best practice forward. Parent-guardian engagement and services. Ongoing research shows that family engagement in schools improves student achievement, reduces absenteeism, and restores parents' confidence in their children's education. Parent engagement in schools is defined as parents and school staff working together to support and improve the learning, development, and health of children and adolescents. The next one is peer-to-peer support. I'm amazed at the way peer-to-peer strategies have matured over the years. Ohio has been a leader in peer-to-peer prevention strategies for many years. These strategies include teaching students skills that they can use to offer support to those that may be experiencing challenges. Trauma-informed practices. As I mentioned on the previous slide, being responsive to children's trauma exposure is a very important part of best practices in prevention. Early identification of trauma exposures and behavioral health needs is very key. Traumatic childhood events can have a significant impact on overall child functioning. Early identification and intervention could offer significant benefits for children's mental health and educational trajectories. But the key is figuring out a good strategy for identifying those with exposures and having access to appropriate intervention, support, and even clinical treatment. Access to treatment. Each school setting needs an efficient process for accessing support for the clinical needs of students. Even though treatment itself is aligned past prevention efforts, the identification and referral process is part of the prevention continuum. Staff support and professional development for teachers, administrators, and other staff is, of course, very much needed to have a healthy environment for students. This area is a critical component for creating a framework for best practices. The professional development dollars that I spoke about a little bit earlier can support your work in this area. Programs and supports provided outside the classroom or outside the school day help to provide a longer time for students to be in a positive environment. That's another great protective factor. This initiative is an opportunity for schools and communities to be reminded of these best practices so they can celebrate what's going well and plan to fill the gaps in areas that need improvement. These dollars can help support strategies designed to fill these gaps. To that end, we have developed tools to assist local districts in a self-assessment process around this framework. We hope the process will assist schools and community partners in the conversation that's needed for successful planning and implementation of strategies based on identified local priorities. The initiative was designed to be a simple process, and we'll review each of these components in the webinar. But first, I'm wondering if we could take a poll. Since we learned how to take those polls, Stacy, would you describe your board or provide a relationship with area schools? Would you be able to launch that for us?
It has been launched.
We've launched the poll, so go ahead and answer those questions, and we'll see what we come up with. We'll give it another couple minutes. I'm sure we have folks on the call that have varying relationships, and it'll be interesting to see the continuum here. All right, about ready to close it up? Okay, one more minute. Looks like we're having a lot of folks enter in.
Ten seconds.
All right, 10-second warning. Wow, those are amazing numbers I'm showing. Great. We're closing the poll now. That's amazing. 75% of those who took the poll work very closely together already. 26% were stated that we were developing a relationship, and 14% serve on committees together. And there's just a very small percentage of those who do not work with schools currently. So that's great news. That will be a great foundation for your work in this initiative. All right. So the next thing I'd like to walk through the process for how the initiative will work. And it's very simple. It's all about convening partners, assessing need, developing a very simple plan, and then telling us what happened. So we're asking Atom boards we're inviting Atom boards to serve as a convener of community partners for the purposes of planning for these dollars. These conveners will work with each school district to distribute funds after engaging in a planning process with contributions from willing community partners, including educational service centers, community-based providers of prevention services. This is an opportunity to enhance existing or establish partnerships and engage new partners in the work. Partners will work together to support districts in their investment and commitment to prevention services and welcome other community providers into the collaboration to support service delivery in schools. If boards have questions about their role as convener, please do not hesitate to reach out to the Ohio Moss staff, and we will help work through any of your questions. The first step for the board is to complete the letter of intent agreement, which is one of the handouts that you can access on the webinar, and send it to the email address on the agreement. The letter of intent document will be sent out to you after this webinar and will be available within the other financial information on the funding opportunity page. So you'll have several resources for getting that. The convener, the board or other partner, which we'll talk about later, will assist school districts with identifying potential planning partners that could be helpful with implementing the prevention work, such as prevention providers, community coalitions, county boards of health, community-based mental health and substance use disorder providers, county Department of Job and Family Services, county boards of developmental disabilities, nonprofit organizations with experience serving children, public hospital agencies, and Family and Children First councils. Most of this list is the same as included in the Ohio Department of Education's Wellness and Success Funding list of potential partners. Hopefully you have relationships with most of these already. I know boards already serve on Family and Children First Council, so that may be a logical place to start. Others may have community coalitions that work with the schools, so that may also be a good beginning. This is an opportunity to widen your net to include others that may be helpful within this focused planning with schools. If you do not have a relationship with the schools already, this is an opportunity to reach out to them and share your network and expertise. We have a listing of contacts for the public and community schools in your county to get you started. We'll be sending that out to you in a separate email. Boards have been receiving the evidence-based prevention allocation for several years to support evidence-based prevention in schools in the amount of $24,800. The allocation guidance for state fiscal year 2020 was amended so that these funds could also be utilized to support the coordination of partnership activities with school districts for needs assessment and planning processes. This additional guidance for the 2020 state fiscal year evidence-based prevention dollars supports the K-12 prevention education initiative and allows for more flexibility if you need additional support for completing your role as conveners. We realize some boards have a large staff to assist with these types of projects and others do not. This change was made in an attempt to support you with these types of challenges if needed. If a board is unable to take on the role of convener, Ohio Moss will seek proposals from Ohio Moss certified prevention providers and coalitions to convene community partners for that specific board area. We will put out a request for applications outlining the responsibilities to eligible prevention providers and coalitions in the identified board areas once we receive your letter of intent stating that you are declining. And again, I hope that you will call and talk with us about any obstacles you may be experiencing and hope to work that out. The letter of intent agreement outlines the following activities and timeline for conveners. The first one is participate in an informational webinar today. So if you're on this webinar, you've already completed the first step. The second one is complete and return the letter of intent agreement to us by November 27th. This form will be sent out again with the link for the recording of this webinar. It would also be available on the Ohio Mass Funding Opportunity page. So the tasks that we're asking boards and conveners to accomplish are to coordinate a planning process with local school districts, educational service centers, and community partners that will include the following components with a target of June 30th for completion of activities. So we're kind of doing this in a rolling time frame to give folks the ability to work together and find each other and have the time they need to work together on it. So the first step would be to identify your potential partners that could support planning and implementation for the school district's continuum of prevention, early intervention, and support strategies. Identify a process for completing the district self-assessment and action plan surveys, which we'll talk about a little bit later, and determine a plan for review and approval of those district plans. Collaborate with educational service centers to assist with the professional development needs of staff and distribute funding pursuant to those approved plans and account for funds. And then at the end, it helps us ensure that each funded district submits their implementation report by July 31st. So conveners are encouraged to develop agreements with their school districts outlining the following responsibilities and timelines. We have a sample agreement to get you started on this that will be available with the other handouts here on the webinar. An example is local school districts will participate in planning efforts with community partners, watch the self-assessment tool instructional webinar that will be occurring on December 3rd, or view the recording. Complete the online self-assessment and plan of action survey tools during the time frame of December 3rd through June 30th, and submit a brief online implementation report. If you have schools that are having problems with completing these tasks, let us know, and we are happy to assist you with how best to help them. If a school is not able or willing to participate, it would be good to have that in writing along with the obstacles for future reference. The sample agreement outlines an option for documenting that decision on the part of the schools. Hopefully, we'll be able to work through any potential obstacles that would occur, and we are available to assist with that. Now I'd like to talk a little bit about the self-assessment tool. Ohio Mass has developed an online tool to assist in identifying current capacity within school districts and prioritizing their critical needs. When considering the priorities of the district, schools are encouraged to use other needs assessment information, such as OES survey results and student data sets that partners have collected. Community partners will work together to review self-assessment information, examine local school district data, identify gaps in the continuum of prevention, early intervention, and support strategies, and assist with implementation and evaluation tasks. For the purposes of the K-12 prevention dollars, districts will complete one self-assessment for their district needs in preparation for developing a local plan. However, in addition, the tool can be used by individual buildings within the district for building level planning efforts. Even though that's not a requirement, it's an extra perk. Upon completion, the self-assessment tool will assist schools with identifying current strengths and capacities for implementing prevention services within the school and community partnership. It will also help with creating priorities for growth and expansion of policies, programs, and services that support prevention efforts. The tool will capture information to allow for summaries of local districts for ADAM boards and community partners. These summary reports can provide baseline information to assist local communities with their planning efforts and help identify trends and needs for statewide investments. After completing the self-assessment tool, districts will develop a brief plan of action describing the programs, strategies, and services they want to implement. Again, I can't emphasize how important the strong community partnerships will assist these plans of actions. They will enhance the delivery and collective impact of evidence-informed prevention initiatives. As in most community processes, partners will discover additional strategies and ways to support each other that can be included in the planning process. Plans should also align with social emotional learning standards, trauma-informed school practices, and positive behavioral interventions and supports as effective and proactive frameworks for improving safety, social competence, and academic achievement for all students. We also hope that strategies will complement district plans for the use of their student wellness and success funds. In an effort to provide consistency and collection of information across districts, an online template is provided. And this slide kind of gives you an idea of what that online template questions will be. Again, the information gained from the self-assessment tool informs the development of a plan of action for increasing access to prevention services for your K-12 students. School districts will complete the online plan of action survey tool describing the following: what needs are being addressed by the program or strategy, what populations, grade levels, high risk descriptions, buildings are being served, what strategies programs are implemented, where and when the program strategy occurs, and how the school will benefit from the program or strategy. So reporting and data collection is also a simple process. Districts may elect to administer the self-assessment tool periodically to identify system changes that have occurred and new opportunities for continued expansion of prevention strategies for the district. So this is a tool that could be easily given once a year just to show the change and development that local buildings or districts have developed over the year. But the only required report for this funding is the online implementation report. And this is also completed within the online tools that we provide, indicating which schools received the funding, how the funds were used, which grades benefited from the investments, how many children were impacted, along with future planning and sustainability efforts. So now we'll review the funding formula and distribution process. Ohio Mass will distribute the $18 million based on a formula calculating the number of school districts in each county and their K-12 enrollment. For example, Franklin County on board will receive $25,000 base since they're one county, along with the number of students enrolled, while Muskingum area, which has a 6-county board, will receive $150,000 base along with the formula for the number of students enrolled. Keep in mind, organizational types within the school community are varied. For example, there are vocational schools, STEM schools. Each board area is able to make a decision of how these dollars will be distributed to any schools that serve students based on the needs you identify. It is important also to remember that these funds are one-time in nature. Effort should be made to use the funds to build capacity and sustainability around prevention programming beyond the time period of the grant. Your funding amounts will be sent out through GFMS and will be added to the funding opportunities page. So I'd like to turn now to allowable use of funds. These funds may be used for the entire continuum of prevention services and supports. Universal is those targeting the general population. Selective, targeting those higher risk populations. And indicated, targeting those with early signs and symptoms. The following lists examples of allowable use of funding. Materials for expansion of existing evidence-based programs being implemented in schools and classrooms, such as Life Skills, PAC's Good Behavior Game, Project Alert, Keeping It Real, Night is Brain Power, Be Present, I'm Here Crisis Text Line, and Signs of Suicide. Purchase and training of evidence-based prevention curricula is also a good use of funding. Locally developed evidence-informed prevention programs you might have going on should be reviewed and approved for effectiveness by community partners with prevention expertise. Stipends for teachers and other trusted adults to oversee, guide, facilitate youth-led programming, after or before school programming, mentoring programs is also another good use of funding. Youth-led programming, parenting programs and educational activities, environmental strategies such as social norms campaigns, awareness campaigns, policy change and development, etc. Campaign expansion for programs like National Red Ribbon Week, Alcohol Awareness Month, Mental Health Awareness Month can also be used as long as you're coordinating those campaigns with your other programming to highlight other services. District may also choose to work together and pool their funding to engage in a larger or more broad project that crosses districts. This will be up to your local planning process to decide. This discussion here on this slide assumes that the board will be the convener. So if the boards are convening, then you will have an increase in your allocation amount that will be listed on the document that is already on the DFMS page. We'll also be putting that up on the funding page. If the board is not the convener, then a bid process will be set up to quickly identify an alternative convener and distribute the funds. The funding formula will be the same for the board area, regardless of who the convener is. Funding information will be found on the funding opportunity page and sent out to you after this webinar, just to be clear. And the distribution process, it will be really important to get your letter of intent in as hopefully on time, because we would like to start releasing the first half of funding in the month of December. So the earlier we get those in, because we'd like to do it out in one push if possible, so the earlier we get everyone's letters of intent in, the earlier we can get that out. Once the plans of action are approved, so once you've gone through the self-assessment process and you have plans of action, you'll be notifying us that your plans of action are completed, and we will disperse the second half of the funding at that time in small batches as we receive those notifications that you have approved those plans. So that's why we say we're having kind of a rolling acceptance of the self-assessment and plan of action according to your timeline. Here is the timeline for the initiative. I'd like to just highlight a few of those key dates. Again, the letter of intent is due on November 27th. We're going to have a self-assessment tool webinar that will describe how to use the self-assessment tool. And then the self-assessment tool will go live on that same day. And then the days after that in December, we'll start receiving as you're able those rolling acceptance of the self-assessment and plans of action. And then the end date, hopefully you'll have everything completed before the end of June. And then we're asking that you send us an implementation report on July 30th. So our next steps that we'll be doing after the webinar is we will be sending out handouts, and Stacy will explain how those are coming out to you and how you can also access them on the webinar. And information will be added to the funding opportunity page on our website, so you can find it there as well. GFMS will list this notice of allocation through their process, and hopefully you'll be sending us back your letters of intent on November 27th. Stacy, I was wondering, do you have any questions from participants that we can try to answer today?
We have had a couple questions, and I've responded to some of those in the questions panel. One of the ones we just had was regarding evidence-based program models, and will we be able to share those? The answer is yes, and we'll make sure that that's available to the boards and everyone involved. There's a number of questions popping up now. Administrative costs allowed for each board.
Okay. So these funds do not have administrative costs for the boards, and that's why we changed the guidance on the evidence-based practices dollars that each of you get. We're asking as part of your role that you be conveners for these dollars, and hopefully that will open up opportunities for boards as they relate to additional community partners and the schools. So if anyone is having additional concerns about that, please feel free to contact us and we'll help try to help work out any concerns that you're having or challenges around that. You see any other ones, Stacy?
We will address additional questions in the frequently asked questions that'll be available. Our intent is to have that up in the funding opportunities area of our webpage by Friday.
Okay, sounds good. So feel free to finish up any additional questions and we'll include those on a page that we're putting together. And you can also continue to share questions with us and we will do our best to get back to you, and feel free to contact any of the staff that will be willing to help you. I hope this process will help us identify creative community partnerships. I know that Ohio Department of Education also wants to highlight those so that we can learn and disseminate models to others. We're hoping that all three of the state investment dollars available to schools can be helpful for improving those innovative solutions to local issues. The tools we have developed for the Prevention Education Initiative can be used to help with planning for the other available dollars. Thank you for your assistance, and I'm looking forward to hearing from you as we move forward.
Before we close today's session, here are a few important next steps. Tomorrow we'll be sending out via the News Now. This recording will be available in the News Now that goes out tomorrow. There will also be a link to the funding opportunities page where the handouts will also be available, as well as a spreadsheet that will show each board how much is coming to that particular board area. Another piece that will go out within the next, I would say, 48 hours will be an email to each individual board director, and that email will contain the link to the webinar, as well as a list of that area's contacts for schools, community schools, and so on. So those lists will be personalized for each county board area. Any handouts referenced in the webinar can now be downloaded from GoToWebinar. We will keep the webinar open for a few minutes afterwards. And on behalf of the Department of Mental Health and Addiction Services, thank you so much for participating in today's session. We'll leave the webinar open for downloading of handouts. Have a good day.